I'm Jane Mahony. I am the Nursing Program Officer at the McGrath Foundation, and I have an amazing group of, or amazing team at the Foundation that work with all our nurses. And we've got this special, amazing group of nurses who are our clinical leadership team. They're actually, first and foremost, breast care nurses. So they've got that currency of practice and they're working with patients. And then maybe for some of them, 2 or 3 days a week, they work as on our team as mentors and leaders for all our nurses. So they have a geographical responsibility. Now, if you can imagine, nurses are an extra special breed, and they're amazing in their clinical roles. And in a hospital setting, it's very different from being in a corporate world. And so you've got these two roles that come together. You've got being a breast care nurse, and then you've got being in the corporate environment and being that leader and the mentor for the nurses that are out there in the hospitals and in the community. And what we worked out was that some of those skills, each skill set benefits each scenario, but sometimes there are some challenges coming out of that fast-paced hospital setting where you're reacting to an environment in the corporate world where you actually have to be a little bit more considered and step back and think about all the factors that surround you before you actually act. And that means sometimes testing your emotions and really kind of coming back from acting very quickly. So we thought we've done some amazing work with Trudy in the past. I'm in awe of Trudy's work because, well, there's many things, but I don't think I've ever met someone that has the ability to take so much information coming from all different areas in a room, different personalities, and to be able to synthesize that information so quickly and to be able to feed it back to the room in a incredibly concise and understandable way that really lifts a room and gets them excited. So Trudy was going to be the best person to bring in to help us to really work on this connecting with a corporate environment versus a hospital environment. So she led an amazing workshop a couple of weeks ago with our clinical leads, these nurses, on some specifics around those behaviours in a corporate world. It was engaging. The nurses had incredible feedback. They had some aha moments, but it was done in a way that they felt very safe, because in the nursing environment, because things move very quickly, and you're surrounded by a large multidisciplinary team, sometimes, there is that fear of people having an opinion or judging, and Trudy was able to run this workshop in a way that the nurses really let down any guard and were curious and inviting of the feedback. The nurses walked away with a number of actions that they need to embed. So we're taking that framework that Trudy has put in place and ensuring that there is rubber on the road, I guess, with those actions and holding the nurses accountable. So Trudy's set up this framework where we have that opportunity to revisit those learnings, revisit those actions, and hold each of the clinical leaders accountable for what they've committed to do. And that doesn't stop. That's a forever learning. And so I guess the way Trudy delivered the workshop and the aftermath, it becomes a part of the nurses' DNA. So we'll be holding them accountable with Trudy's help over the coming months and have an opportunity to bring them back together and refresh. So we're very grateful for the support and the powerful kind of impact that this session's had on the team. So thank you.